Assistant Professor Kojima is my associate. She's now at the Department of International Medical Communications that I started. And she has done a lot of work on medical publishing ethics. And this year, there was quite a big change. And it's essential to know what the International Committee on Journal Editors thinks about manuscript preparation, especially when doing the format. And also you need to know the publication policy internationally, and also ethical issues, and also the standpoint and thinking of the journal. Why? Because the paper can be rejected. You might make career-ending mistakes. So where do you turn for information? Well, until this year, they were called the uniform requirements. Uniform requirements for the submission of manuscripts to biomedical journals, a very long title. Now it's called not requirements, but recommendations. Over the years, it's become softer and softer. And it's leaving more authority, more responsibility with the journal and with the author. So you have to be sure that you know these recommendations that appeared this year and the instructions to authors. Now, the International Committee of Medical Journal Editors, let's look at the history, the purpose, main components. Well, manuscript preparation is something that you know. Roles and responsibilities in publishing and editorial issues is something that may not be so well known. So, what are the recommendations? Well, the recommendations were developed by the International Committee, and they are now being known as the ICMJE recommendations, okay? So it used to be called the UR, Uniform Requirements. And it's the International Committee of Medical Journal Editors. And this is a very small group, about maybe 9 or 10 people. The editor-in-chief of the New England Journal of Medicine, British Medical Journal, the Lancet, really top class. And they were known as the Vancouver Group because they created the style after their first meeting in Vancouver. And they created the ICMJE recommendations, the former uniform requirements, or Vancouver style. And one of the interesting things about this is the uniform requirements developed because of a secretary. A secretary of a rather busy clinician who published a lot. He sent papers. Of course, papers get rejected, so they have to be rewritten. And the secretary would then have to, each journal had its own style of references. So she would have to sit, nowadays we have EndNote. In those days it was a hand typewriter. And she had to sit down and spend 3 or 4 hours retyping, not semicolon, colon, no, not colon, semicolon. And so she wrote to the New England Journal of Medicine and said, look, you're wasting my time. No, she said, is it not possible to have a uniform system of references? That was about 1974, I think. So people started saying, yeah, we should have some uniform guidelines. So what they came up with in 1979 was the uniform requirements. And now there are over 600 participating member journals, and the recommendations give detailed explanations and instructions on manuscript preparation. Now, one advantage is that because they are more or less uniform, you do not need to reformat the entire manuscript when submitting to another member journal, theoretically. In other words, if you send your paper to Journal A and it's rejected, you can then send it without reformatting to Journal B. However, it's not so simple. If Journal A uses 3 keywords and Journal B uses 5, when you resend it to Journal B, you should use 5 keywords or vice versa. So this is the homepage of the ICMJE, which you can look at and frequently asked questions at a glance, clinical trial results, etc. So you can see it better on your own computer. Now let's look at the history, which I told you a little bit about. And they had the first meeting in Vancouver to see about citing references. And at this point, the lack of uniformity in medical writing was a real problem. And there were no guidelines. So it was even more difficult then, perhaps, than today. And the next year, in 1979, they published the first edition of the URM, the Uniform Requirements. And they provided authors with a standardized format for writing papers. And this was based on the reference style of the National Library of Medicine, the NLM. And they updated and revised every 2 to 5 years after 1979. And it was considered kind of the Bible of medical writing. But as I said, over the years, they became a little softer and they began to say, okay, these are our thoughts, but you should also give pay attention to the instructions to authors. I don't know if any of you have been at a journal editorial board, but the journal editorial boards, when they discuss the instructions to authors, they spend a lot of time going over word by word exactly how they want the papers to be sent. So while the uniform requirements and the recommendations are important, the instructions to authors are important. And also in terms of history, well, first of all, they standardized the manuscript format. Then, almost 20 years later, they revised the entire document to include electronic submission sources, personal communications, duplicate publications, COI, patient privacy. None of these were in the 1979 version. And in 2001, there were revisions regarding COI, conflict of interest. And 7 years later, the significance of ethical issues, authorship, which we'll talk about later, conflict of interest, were increasingly emphasized, and the uniform requirements told authors to follow each journal's instructions for authors concerning these items. And in this year, it was renamed as the recommendations for the conduct, reporting, editing, and publication of scholarly work in medical journals. ICMJE recommendations. That's all you need to reflect its current content and purpose. So, okay, what are the recommendations for? Let's first look at the purposes. Now, manuscripts need to be easy to read and edit for editors and reviewers because the reader should be able to absorb the content quickly. Large numbers of manuscripts are submitted. Editors and reviewers are usually very busy. But also, there are two other things I want to mention. One is most OK journals have a rejection rate of 70 to 80%. So if you're rejected, don't be too disappointed. Just keep trying and trying and trying. Okay? And the other thing is, not many people think of this, but a reviewer for a journal is working as a volunteer. Okay? And if you're working as a volunteer, and I give you this these pages and I say, could you check this English for me by next week? What time of day are you going to look at it? Probably at night when you go home, when you are very tired. So, it has to be easy to read. And very often, the title's important, the abstract's important, but also in the discussion, the first sentence of the discussion, I usually start out with, we set out to determine whether, because the reviewer is tired, it's 11 o'clock, wants to go to sleep, but just a little bit more, okay, is the discussion. But the reviewer's been reading the introduction, materials and methods, results, a little bit confused. So you refocus, you reset the mind of the reviewer. Okay, it's good for the readers, but before that, before the readers, you have to get past the reviewers, right? Even if the readers can read it, if the reviewer doesn't pass it, you're out. And editors and reviewers are usually very busy. And in their recommendations, they mention specifically that they're trying to best practice, ethical standards, help authors, editors, and others involved in peer review create accurate, clear, unbiased medical journal articles. So, this is a very long sentence, but ease of reading is very important. So, simple sentences are fine, just as long as there is no confusion over the meaning. One of the best writers of English in Japan that I know is a pathologist, and he's retired now. And his spoken English was excellent, but his written English was like middle school. This is a book. The book is red. It has 220 pages. Instead of saying this red book has 220 pages. But he became very, very famous, very highly published, because there is no ambiguity. No way of misinterpreting what he was saying. And if you're, well, there are over 600 member journals of the ICMJE, so that's almost all the journals you can think of. But even apart from that, non-ICMJE member journals also use these recommendations. But you should also check the instructions to authors of each specific journal. And these are examples of the ICMJE member journals and organizations. And you can see that they're very representative. And in their information for authors, excuse me, the Lancet states it is a signatory journal to the recommendations. So this just came out this year. It is certainly worth taking a look at and having on your desk or in a file on your computer so that you can refer to it easily. And again, this is not the Lancet, but the NEJM. And again, they say these guidelines are in accordance with the recommendations of the International Committee of Medical Journal Editors. However, the New England Journal will not accept any duplicate or secondary publication, even if it meets the standards of the recommendations. So, to look a little more closely into what it's about, the main components are manuscript preparation. Well, that's pretty easy, I think, for all of you in terms of manuscript preparation, the format references, cover letter. But then we get into roles and responsibilities. What is authorship? What is conflict of interest? What needs to be declared? What does not? And again, duplicate publication, secondary publication. Now, this secondary publication is, I think, of great interest to people who have published in another language like Korean or Japanese. So I'll discuss that in a little more detail later on. Now, first of all, manuscript preparation. It gives the general requirements for each section, the introduction, materials and methods, results, and discussion. And these are intended to improve not only the quality, but also the clearness, the clarity of the manuscript, and to facilitate editing. Excuse me, sir. And as I mentioned before, it also mentions that the journal's own instructions must be followed carefully. And the article title should be as short as possible, concise and informative. This also goes for posters or oral presentations. So you don't write research on or study on. Of course it's research, of course it's a study. I mean, it's a waste of space. And the article title plus the keywords together should include information that will make it easier to retrieve the article electronically. Now, this is a little difficult, but in the keywords, you should try to use words not in the title, so that you will have a wider target for browsers to hit. Okay? For example, today I was doing editing a paper on that involved a certain operation, and that was not in the title, but it was in the keywords, and that was good. And the highest academic degrees, and the affiliation, name of departments and institute to which the work should be attributed. This can be difficult if the person has moved hospitals in the interim, but in that case, if you want, you can list both institutions. And of course, because of the conflict of interest, sources of support, grants, equipment. And you should give the word count not only of the text, minus the abstract and minus the references, and also the abstract. Total number of figures and tables. A disclaimer. For example, a statement that views expressed are the author's own, or that the author does not accept any responsibility for the safety of the procedure described. So this is limiting your responsibility with regard to the paper. And who is the corresponding author? And as I said before, it's important to have a COI statement, and also, if it's necessary, an acknowledgement for editorial or translating assistance. The structure and length can differ according to journal, and sometimes it's difficult. You have submitted a paper as an original article, and the editor-in-chief comes back and says, well, maybe a letter to the editor. I don't know about in Korea, but in Japan, a letter to the editor is considered an academic achievement. So if that's the only way, if there's no other journal that will respond, then go for the letter to the editor. And you have to be very clear in the purposes and basic procedures. And in the abstract, you should be clear to emphasize the new and significant aspects. This is both for papers in journals and in international congresses. What is new? Why should I take her paper and put it as a poster in my congress? What's so good about it? And another point is be sure that the abstract reflects the content of the article. Now, sometimes as you go through the review process, you change the text a little bit, or you change some figures. And sometimes then later the abstract is not good enough for the new version. So you have to be careful about that. And if you are doing an RCT or any clinical trial, you should publish the clinical trial registration number at the end of the manuscript. And also, if now in the introduction, the best examples of introductions are the New England Journal of Medicine. They're really clear. They give you the background, what the problem is, what we don't know, and what we are going to do to try to find out. Just those 4 points. And especially if you have a hypothesis, you have to give the hypothesis. Even if you're wrong. And never include data or conclusions in the introduction section. We found that. No. We set out to determine whether, that's okay, or in order to gain insight. That's New England Journal of Medicine likes that. In order to gain insight into, okay? But you never give the actual conclusions. And in the methods, you have to say why the study was done this way. And another important point is you can only put in information available at the time of the initial planning. When you set out to do this study, that can be put in the method section. But anything that you find out during the study, that should be put in the results. And this can be kind of tricky, because to make it simple, it's easier if you put it in the methods sometimes, but you shouldn't do that, okay? And the selection, actually this is a word you should avoid. If you say, we selected 165 patients, that implies that the reader or the reviewer thinks, select? Maybe selection bias, you picked the good ones for your study. So it's better to say something like 165 patients who satisfied the following enrollment criteria, were enrolled, okay? So that's objective. Or of 240 patients who satisfied the enrollment criteria, all patients were invited to take part in the randomized study, and 180 agreed to participate. So, okay, you know that there were more than 200 to begin with, but actually only 180 of based on their decision, joined the study. Now, if you are, let's say you're doing a study on breast cancer, you may want to limit that only to women. But in that case, you have to give a reason for excluding the rare cases of men with breast cancer. For example, because of possible hormonal differences, we decided to exclude male patients. So you have to justify the relevance. And technical information, equipment, manufacturer's name and address. Now, the manufacturer's name, if it's an American journal, and you say Boston, Massachusetts, USA, they probably will not like it, because America is the center of the world. Everybody knows where Boston, Massachusetts is. So most American journals do not have USA. But if you write to a European journal and you just write Boston, Massachusetts, the editor might say, Boston, Massachusetts? Where is that? So you have to look at the journal, your target journal, and see, do they use USA? Do they use the countries or not? And once you have given the address once, if you repeat the manufacturer's name again later, you do not need the address. But your description of the methods and the equipment should enable other researchers to also try to reproduce your results. For drugs, you should give generic names of chemicals, the dosages, and the administration routes. Now, if you're using a very new method, one that is not generally known, then you should describe it and give the reasons for using this new method, and you must also list its limitations. If it's a well-known method, just according to the method of A and B, and with a reference. Brief description methods not well-known. Again, as I said before in the previous presentation, the reporting guidelines. Consort is the most well-known. There's Strobe, Prisma, START, and many others. So you have to make sure that if the study that you're doing is covered by a set of guidelines, that you're using those guidelines. And in the results, of course, logical sequence, avoid repeating data, and also try to avoid repeating data in the tables and figures in the text. Make sure that if the figures and the tables should be able to stand alone. In other words, just looking at the figure or just looking at the table, the reader should be able to understand without having to read the text. And that will save space. Remember, for an editor or reviewer, space is very important. And especially for paper-based journals, because it costs money. Again, in the discussion, we set out to determine whether you reset the mind of the reviewer, and you, especially here, you try to show what is a new important thing you're trying to show. And then the reviewer thinks, aha, that's interesting. Can they show that? And you have to be clear in stating the conclusions and avoid repetition of any details in the introduction or results sections. And usually in the second last paragraph, the penultimate paragraph, you talk about the Korean peninsula. Pen is almost, insula is island, so pen is almost. So penultimate is almost last, second last. So usually the last paragraph is the final conclusion. The penultimate paragraph is, this study has several limitations. Usually size of sample or any bias or skewing, anything like that. And it's better that you point it out than a reviewer points it out. And it makes the reviewer understand it better, and it also appeals as if you're being very honest. And for references are very difficult. The references are the one part of the paper that has the most mistakes. And especially recently, there are more and more retractions. People are withdrawing their papers more because they're under more scrutiny. They're being looked at more carefully, and they're also under more pressure to publish in high impact factor journals. And so in the last few years, the number of retractions from New England Journal of Medicine, etc., other high impact factor journals has increased very much. And this is a huge problem because you may have on your desk a paper, and in the references in that paper, they have that A and B reported da-da-da, and reference number 31. So you think, oh, okay, and you put that in your reference, but unknown to you, it's been retracted. There was a problem with the paper. It doesn't exist anymore. And then somebody reads your paper, and says, oh, here he's quoting A and B, reference number 31 must be okay. And it's a great problem to get rid of retracted papers. So the editorial boards basically decided it's up to the authors. We can't be world's policemen of retracted papers. So it's up to the responsibility of the author to check that the references are accurate. And if you want to make sure, check PubMed. That's the most accurate single body of information on references. If you have a paper that's submitted but not accepted, unpublished observations or unpublished data. Up to now, many people wrote data not shown. But now it's considered better to have unpublished observations. And if you have submitted references, you cannot use it as a reference number, but you can mention it as unpublished observations. If it's your own data, that's fine. If you have personal communications, if you have a letter from somebody stating that they have obtained certain experimental results, first of all, you write to them and ask them, can you use it in your paper on ABC to be published to be submitted to the XYZ journal? And again, you need written permission, and you have to keep it. Otherwise, the person can say, oh, I didn't say that. I never said that he could use that. And the references, they encourage you to follow the format found in the NLM webpage and should be numbered consecutively, but check target journal instructions, because some journals still use alphabetical order or chronological order. So if you want to get published in that journal, you have to write it in the style of the journal. Even if you say these are the ICMJE recommendations, you're submitting to one journal, make sure you fit that journal. And as I said, the PubMed is the main source for determining if there are retractions, and for journalized abbreviations, use Index Medicus. Tables can be used to present a large amount of data very compactly. If you are using a table from another author, you have to be sure that you get permission and that you keep that permission. And as they say here, permission is required from the copyright owner, irrespective of author or publisher. So as you can see here, with the recommendations for the manuscript preparation, they're asking for greater author responsibility. It's not enough to say, oh, I didn't know it was retracted. And if you're using any photographs of subjects, you get written permission. Even if it's the back of the head. Even if it used to be only if identifiable. And people would put little black dots here and here, and you could tell who it was. But even if it's not recognizable, a photograph must be accompanied by written permission, and you should keep a copy. This is not the case for X-rays or CTs, but be sure that you have eliminated the name of the person on the CT or MRI. One of the journals that I edit for is Gastroenterology, the Journal of Gastroenterology, and they published an issue, and 3 days later, the author called them up and he said, why did you show the name of the patient? And what happened is the author put a post-it, the sticky papers, to hide the name. But in the printing, the post-it fell off. Luckily, the patient didn't find out, but that can happen. So if you have a CT or MRI with the name, use scissors and cut. It doesn't look good, but it's safe. So again, greater responsibility for authors and greater concern for the author's responsibility towards patient privacy and rights. And you should spell out the words first before the abbreviation. And previously, the uniform requirements asked you to use international standard units, which are very complicated. Now they say use metric, which is much easier and more reasonable. Now, roles and responsibilities. Authorship, conflict of interest. Okay, what is an author? Okay, in 1979, the uniform requirements appeared, but it was not till almost 10 years later that they mentioned authorship criteria. And until 2008, until 5 years ago, there were 3 criteria. This year, the recommendations made a 4th criterion regarding accountability for authorship. And this is in relation to the honesty, the integrity, the validity of the work. So these are the 4 conditions, okay? Substantial contributions in design, analysis, and interpretation of data, and, not or, and, writing a draft of the article, revising it for intellectual content, and, not or, giving final approval of the paper to be published, and being accountable for all aspects of the work related to the accuracy, integrity of any part of the work. And you have to be willing to take responsibility for that. So you have to make sure that you read, understand, and agree with any paper that has your name on it. And looking back on the last 40 years, I can only think that they will become more and more strict about ethical questions. So I would say, please be sure to follow these. So, question. If a professor has obtained funding, does that entitle authorship? And the answer is no. Now, as I said, different cultures have got different pressures at work, and maybe the professor in your department insists on his name going on. I never did that. Unless I was responsible for the part of the work. But I believe that each person on the faculty should be able to act freely and be responsible for their work. Okay, what's a guest author? We did that before. And how should authors be listed? So, what the ICMJE recommendation states that the order should be a joint decision of the co-authors. So for these 4 people, it's up to them to decide. I'm the editor-in-chief. I don't know. Maybe he did all the work. Or maybe he did. I don't know. It's up to these 4 people to decide. And you should decide the best thing is before writing the paper, because there are more problems and quarrels and lots of hassle because of the order of authorship. And usually the first author contributes the most, the other authors are listed in descending order. But in some universities, maybe the corresponding author is the last author, or the second author, or the first author. It's up to you in your individual institution to decide on that. Okay, so supposing somebody has made substantial contribution in design, written a draft, agrees to be accountable, but has not given approval. That person should be listed in the acknowledgement section, together with the editor, with the medical editor or the translator. And the conflict of interest form, again, you can see since 2007, there's been 2007, 2008, 2009, 2013, more and more emphasis on the ethics. And this is the really dangerous part of a medical career. And you cannot be too careful. COI policies differ by journal. Revision made at time. Relevant COI is 36 months prior to submission. Well, this is what the ICMJE says. I'm on the conflict of interest subcommittee of the Japan Medical Association. We say 24 months. So depending what country you're publishing in, it can differ. So please check with the journal or the medical association for the country in which you're being active. And list COI by entity, give type of relationship. Now, some societies, for example, the American Ophthalmological Society, capital A is a salaried consultant for a company making a drug or device listed in the paper. Small a, salaried consultant for a company competing with the drug or device listed in the paper. And capital B, small b, capital C, small. They have a whole range of codes to indicate the exact type of relationship, whether with somebody in a company described in the paper or in a competing organization. And this is their potential conflict of interest form for disclosure, which you should carefully look at. This should really be translated into Korean. It should be available for all Korean medical personnel. Now, publishing and editorial issues, okay? Duplicate publication and secondary publication. Dual or multiple submission. Authors should not submit the same manuscript in the same or different languages to more than one journal at a time, at the same time. But you can do it. You can have redundant duplicate publication when it overlaps substantially one already published. Now again, this is what you shouldn't do, but there are conditions that allow you to do it. And the ICMJE says that the readers of periodicals should be able to trust that the paper they are reading is original, unless there is a clear statement that the author and editor are intentionally republishing an article. And so it's possible to do it, but you must indicate where it was first published and provide a copy of that first, even if it's in Chinese or Korean or Japanese, it has to be provided with the references. And you also have to remember that different journals have different rules on prior publication. The New England Journal of Medicine will not allow any prior publication. But most journals will, if there's a reason and if the data in the paper is going to be valuable to their readers. For most journals, that's the bottom line. The only thing is impact factor. Because if it's published first in Japanese, the Japanese journal will get listed. The American Society of Nanto will not be. So their impact factor will go down. Okay, so it would have to be a really attractive bit of information or study for them to publish that. But as I said, secondary publication can be possible, and there are certain conditions. One is both journal editors must know. First of all, you contact the Korean editor-in-chief, you get permission. Then when you submit, you send a letter, a copy of that letter allowing secondary submission. And if the editor says, thank you, but we're not interested, maybe you could write a letter to the editor, 1 page. Well, it's up to you. And the publication interval, usually this is not a problem. Usually this is, as long as it's more than 1 week, not much. And the important thing is it must be directed towards a different audience. Well, the audience that's reading Chinese is not the audience that's reading French or English, usually. And because it is secondary, it must exactly reflect the data of the primary version. You cannot change it. It has to be the same, because you're in a footnote, you're saying that you're clearly stating that it has been published in whole or in part. And so the data must be the same as in the first publication. And this is a little bit difficult, but they say that the title of the secondary publication indicates clearly that it is a secondary publication, or complete republication, abridged republication, complete translation. But usually, most journals will accept you putting that in a footnote. It doesn't really need to be in the title, usually, as long as all the other criteria are satisfied. And as I said, the National Library of Medicine Index is the first journal only. So if it's published in another journal, that will have a slightly negative effect on the second journal's impact factor. And in conclusion, the previous uniform requirements originally was developed for standardizing manuscript and reference formats. That's all, very simple. But now the ICMJE recommendations, they cover manuscript preparation, author responsibilities, publishing issues, editorial issues, but especially transparency, making sure that everything is clear, the honesty and integrity of the work, and making sure that you have followed publishing ethics. And the URM is now translated into many languages, and we're translating it into Japanese right now. And you can go here or www.ronbun.jp. And if you are unsure of anything, write to the editor-in-chief before submitting the manuscript. That way there's no doubt later, and you have to keep the records of all communications between you. Thank you very much for your attention. If you have any questions,